Here we're looking at drug delivery dosages and procedures. So pharmacotherapy, so just to kind of introduce this topic. So again, we're looking here at the treatment prevention of illness, disease, using some type of drug, and that's a drug, whether that's a chemical or biological origin. So really when we look at whether treatment of a condition is going to be successful using pharmacotherapy. So looking at the success of the drug. So we look at the choice of drug, the dosage regimen, which we're going to be talking about, and we're going to be talking about characteristics of the drug, how it's kind of administered to the patient, and the patient's assessment. So we're essentially looking at the individual characteristics of the patient. We're going to be looking at the known pharmacokinetics of the drug, because we're going to basically look at how the person's body is going to impact the drug, which is going to kind of dictate to us what type of form of a drug is going to be giving, and the actual dosage of the drug. So all that's going to impact your dosage. And then the provider's going to, another choice that's going to be looked at is, are we going to use a drug where the effects are immediate? So this is the type of drug product we're looking at. Or is it going to be an extended release or some type of modified released version of the drug? So is it a drug that's going to have, kind of immediate effects on the person? Is it something that's necessary to have more of an extended, more prolonged effect? So again, athletic trainers might not use all of the different routes. Obviously the common routes that we're going to be looking at are either the enteral route, which is basically through the gastrointestinal tract, or your oral route, or your parenteral route, which is outside of the gastrointestinal tract. So enteral is within the gastrointestinal tract. Parenteral is outside of the gastrointestinal tract, and basically the routes of administration there, you're looking at injection, inhalation, transdermal, and topical, because all of those routes are basically outside of the gastrointestinal tract. So again, depending on the clinical setting you're in, again, many times, athletic trainers are going to administer either prescription in certain situations or over-the-counter medications. It's really important for us to kind of know all the different drug delivery systems, regardless of what we mostly encounter. So drug delivery systems, again, approaches formulation and a system to safely deliver a drug to achieve a desired therapeutic effect. So we're basically looking at how a drug is going to be basically given to a patient, in what form, and then that obviously then the dosing and everything beyond that would be an important factor in how the patient gets the drug administered to them. So proper delivery integrates the following elements. So we look at the form of dosage. So what form is the actual drug being delivered in? We look at the dosage regimen. In other words, how often and how much of the drug is going to be taken by the patient. We look at the drug release information and the route of administration. Okay, so again, biopharmaceutics, again, here the primary concern with many things is drug bioavailability. So biopharmaceutics links the physical and chemical properties of the drug and the drug product to their clinical performance in vivo. So again, there the big thing is that the bioavailability. So how much of the drug is going to be available to the person once they take it. And then again, another thing we have to look at, does the drug act locally? Again, that would be very common if we're talking about a pill, or does it work extravascular, so a little bit more of a systemic effect? So that's another question that has to get asked. And again, we're going to be looking at biopharmaceutics looks to balance the amount or extent of the drug, of the particular delivery of the drug. So looking at routes of administration, again, is going to be based on many different factors. And some of those factors, or probably some of the more important factors, include the rate that the drug gets absorbed and the duration of the drug action. Okay, so again, those could be, there's other factors. Those are probably two of the more important ones. So dosage form could obviously influence the bioavailability of a drug. So for instance, a drug that's given intravenously. So if we look at some different routes, okay, so a drug that's given intravenously that's 100% bioavailable. Okay, so it's basically in an intravenous delivery, you're getting 100% of the drug given. Whereas, in some cases, some GI or some through the enteral route can be absorbed at 100%. Now, not all of them can. So in the case that a drug, isn't 100% bioavailable, that's going to impact how much of a dosage the person's going to get. Because in those cases, the dosage may need to be higher because of the fact that it's not all bioavailable. Okay. In some cases, some drugs are well absorbed by the gastrointestinal tract, so some of them can be dosed based on that. So clinical decisions, again, are going to be based on, again, the safety and the physiology are going to play a role in this, okay? Because, again, not, for instance, IV drugs, again, they're 100% bioavailable. However, there are concerns. Anytime you're giving an injection, there's always a chance of like an infection. So that's something that has to be taken into consideration. And you look over on the illustration here. So here you have all your different routes of administration. So you have inhalation, topical, your other parenteral versions, so all the different types of injections, intravenous, intramuscular, subcutaneous, epidural, and intrathecal. And then you have your transdermal patch. Here you have your common enteral, so oral sublingual tablets, different films, buccal tablets, as examples. So another thing to kind of take a look at in your textbook, kind of in conjunction with this, we're going to be talking about the different forms of delivery. Table 6.1 in your textbook would be a very useful source of information to kind of look at, because it kind of summarizes all of the different types of routes of delivery, and it kind of gives a little description. So we are gonna talk about some of them, but that could be kind of a nice little thing to kind of complement your notes and to pay attention to as we're going through this. So with enteral drug delivery, so again, these are the different routes you can get with enteral drug delivery. Again, remember, we're looking at delivery that involves the gastrointestinal tract. So with looking at it from the standpoint of drug delivery via the gastrointestinal tract, again, advantages, for the most part, and again, oral are probably the most common. Again, they're not all oral. Obviously, there's the rectal route involving enteral drug delivery. But for the most part, it's very simple, convenient, very easy for an individual to do. The drawbacks: food interaction, slow delivery, and at times compliance. So don't forget, so when a drug gets administered via enteral drug delivery, you're going to have that first pass effect. So any drug that exhibits a significant first pass metabolism has to be administered in a sufficient quantity to make sure that a good amount of the drug actually gets into the systemic circulation. So we talked about the first pass effect. That's basically the more or less the filtering effect, if you will, of the liver kind of metabolizing the drug before it kind of gets into the systemic circulation. So it's really important. And again, you're still considering the fact that with the enteral drug delivery, that the drug still has to be able to pass through portions of the gastrointestinal tract to get into the systemic circulation. So again, it's got to be able to get through the epithelial membranes. You have to consider blood perfusion. Again, those items become very important when you're looking at the gastrointestinal tract. The first pass effect, again, we kind of talked about this already. Again, you want to make sure there's enough concentration of a drug, and again, this will kind of affect the overall dosage of the drug and how often it gets given. And again, as we said, oral drugs are affected by various factors. Again, the other factors within the gastrointestinal tract, which I had already led on to, it's really going to kind of impact, again, the actual administration of the individual drug. So the oral route is probably the most common when you think of enteral drug deliveries. Again, swallowing a tablet or a capsule. There are other enteral routes, as we discussed. So the buccal route, which is basically when a drug is placed between the gum and the cheek, and the sublingual route, which is basically a drug is placed under the tongue. So the thing to remember about the mouth, the oral mucosa has a very thin epithelium, so it does favor absorption really well. So it's a much thinner epithelium. There's a good amount of blood supply to that area. So a really good way that if a drug could be administered via this, that you can get really good absorption. So these two particular routes have the ability to bypass the harsh GI tract environment. So we all know like the presence of like acidity and mucus and bile in the gastrointestinal tract could potentially also affect the ability of a drug to get absorbed. These two particular routes, you avoid that. You also do avoid a first pass effect with these, just because it's getting directly administered via the vasculature in the mouth is basically taking it into the systemic circulation. Now the rectal route, so rectal suppositories, so these are where medications are placed in the rectum and they're absorbed that way. Again, they're easily absorbed. These are going to be typically options when a patient maybe can't take an oral medication. They can't take a tablet or a capsule. Maybe they're vomiting, they're very sick, they're unconscious. You need something a little fast acting. So that is going to be an option for individuals such as that. With rectal suppositories, there is some that's going to be, unlike the buccal and sublingual routes, they're going to be subject to first pass effect. So again, your advantages with your sublingual and buccal, easily administered, rapidly absorbed. They bypass that harsh GI tract environment, and they avoid that first pass effect. So looking at any oral dosage forms, again, your factors to consider. So the gastric transit time, so basically how long it's going to take with patients, and this could be a little bit variable. So basically how fast it's going to go through the gastrointestinal tract, the state of the dosage form, and whether the patient's in a fasted or fed state. And again, some medications will have to be taken or will be highly suggested to be taken with food. Others, they'll want you to take it on an empty stomach. Again, it just kind of depends upon the type of medication. However, pretty much any medication taking with food, it is going to slow the absorption a bit. Table 6.2 in your textbook just goes over the various oral dosage forms. So make sure you're aware of those different oral dosage forms and kind of what they come in. So again, the various things, so tablets, capsules, caplets, so there's soft gels. So take a look at all of those different forms, make sure you could differentiate. So particularly when you're just talking about pills, if you will, there's different types of pills. So a tablet is different from a capsule, which is different from a caplet. And then you get into things like soft gels and kind of what are how they're made and what are some of the advantages and disadvantages. Same thing with like your liquid medications. So you have solutions and you have suspensions. So make sure that you know the difference between all of those. So you could either pause the video and take some time now and just kind of take a look at those, or definitely when you're finished, make sure to go back and go over that table. So the phases of absorption of enteral medications, so again, rate of release and rate of absorption are critical as far as a drug. So, this is critically important in determining kind of like your onset, the intensity, and how long it's going to last for. So this process is really important for that. Again, most of your oral drugs are going to be systemic. And again, the systemic drug absorption from an oral drug basically looks at how fast a lot of these processes take place. Okay, and there's going to be three phases. So there's three phases of an oral drug and the way it gets absorbed. The first phase is the disintegration, and that's just the releasing of the drug. So the drug basically breaking down, and the dissolution of the drug product into the body's fluids. Then you have the permeation across the GI tract lining. So, if you're taking, let's say, a tablet, you take the tablet, you consume a fluid with it, you swallow it. It breaks up in the gastrointestinal tract. It has to then get through the GI tract lining. So again, this is part of the challenge, if you will, of oral drugs. Again, as convenient as they are to take, they do require some things to take place for them to be absorbed, and one of them is to get across the GI tract lining. And then is the drug disposition during GI transit. So this is basically the stability of the drug, how the metabolism as the drug is kind of going through the gastrointestinal tract. So these phases of absorption will dictate, again, the how much of the drug is needed and the overall effectiveness of the drug. So the modification of the release of drugs that are administered orally. So this is an important thing. So there may be certain aspects of the drug. So additional drug disposition may occur in the systemic circulation and potentially reduce the concentration of the drug available to the target tissue. So how a drug is kind of made will sometimes dictate how the drug gets released. And it's going to be important because, again, some drugs you want an immediate effect from, whereas some drugs you may want like a very slow, sustained absorption. Or in some cases, you may want something to be released a little bit quicker. So you have different types of drugs. You have the immediate drug release, you have the immediate release, which the drugs are basically absorbed with no delay. And then you have modified release. So it's these modified release ones where you either get like an extended, a sustained, or even a delayed release, depending upon the drug profile. So, when we look at the drug release profiles, we're basically looking to do this for a couple different reasons. You could be looking at the stability of the drug as it's in the gastrointestinal tract. So if it's a drug that might not be could be affected by something within the GI tract, they may want to modify it just to make it a little bit more stable. It may help with safety. Some drugs, if maybe they're absorbed too quickly, can have the potential to produce a lot of adverse effects. And again, just for efficacy of the drug, it may just not work as well. Whether it's a drug that maybe needs to be a little bit like of a longer release or one that needs to be absorbed, how effective it is may be dictated by that. So it's basically looking at the profile of the drug will kind of determine and how it's going to be used in what type of modified release you're going to be looking at with an oral drug. The other item to consider with modified released oral drugs is that many times they don't have to be taken as frequently. So again, a lot of your drugs that have a slower release, they also too don't have to be taken as frequently. And that for instance, one of the things that could help with is your compliance. Okay, so examples of modified release drugs. So you have your sustained released. That's a more prolonged and controlled release. So that, again, basically a certain amount of the drug will get released in a very controlled manner. You have delayed release, and that's when a drug gets released at a specified time. So in other words, when the drug gets taken and administered and taken by the patient, again, the drug doesn't necessarily get released right away. In other words, basically the formulation of the way they make the actual drug itself kind of delays the release. So they take the drug, it kind of takes a little bit longer to break down, and gets released a little bit more slowly. Extended release, again, these are good with drugs that have a short half-life. Many times they have an enteric coating that slows the absorption to lengthen it. So these are drugs that'll have like a specialized coating around them. Many times, like some drugs that could actually be a little bit harsher on the stomach, for instance, sometimes even have that enteric coating, and that could assist with preventing issues with that. And then controlled release, these have a short half-life and duration. Again, this limits the plasma fluctuations of the medication, and again, many times they'll have a coating as well around these medications. The textbook also talks about transdermal controlled release. So transdermal obviously involves it getting absorbed through the skin. Um, and again, it's kind of the same idea. It's a controlled release with basically just a transdermal delivery. So again, a drug will be basically penetrate the skin. And again, drugs for transdermal delivery have to have a suitable skin penetration, and they have to have a pretty high potency as well. But that is another form of like a modified release is with the transdermal medications. So with parenteral drug delivery, so here we're looking at direct entry into the body, going outside of the gastrointestinal tract. So again, parenteral administration, this is the most controlled delivery method. However, again, there's a lot of advantage. Much like oral delivery and the various forms of enteral delivery, there's advantages and disadvantages. So this obviously the amount of control you have over the amount of medication getting to the site is very good. You're basically administering the medication right into the tissue space via the injection, and it immediately overcomes any barriers that, for instance, a lot of your enteral medications have. So if you think of just your oral route with enteral medications, there's a lot of barriers and things for that to get through. You have aside from the first pass effect, which we gave a lot of attention to, you still have all of those things within the gastrointestinal tract that, do become issues related to, how quickly the medication can get absorbed and how, how the dosage is concerned, how well that's controlled. So here you do have a lot of you have very good control over it. Now, your disadvantages. So risk of infection. So anytime a person is getting an injection, there's always a risk of infection. Albeit that risk is very small. If proper steps are taken, there's always the chance of an infection with an injection. It's limited to administration by trained personnel. So only trained personnel can administer injections. So again, it is a slightly more complicated way to administer a drug as opposed to an oral drug, which somebody could obviously just, in the case of like a tablet or a capsule, they can just, swallow a pill. And then the last is the toxicity increases if improper administration. So the thing about parenteral drugs is they're many times in most instances, very rapidly absorbed. So, a small incorrect dose could really potentially have a lot of very negative effects because of the fact that it basically gets, absorbed so easily. When you're looking at the picture here, so these are the most common parenteral routes of administration, going from the deepest to most superficial. So here you have an intramuscular injection. So you see the different layers of tissue over here. You have an intramuscular injection getting directly injected into the musculature. Again, the musculature has a very good blood supply, so very good absorption there, but that is also the deepest. Intramuscular injections do also tend to be, fairly uncomfortable for most people, just because piercing into the muscular tissue does hurt a bit. You have your subcutaneous injection. So there's your subcutaneous tissue, which is immediately below the dermis and epidermis. You have your intravenous, which is basically going directly into the vein. We had talked about bioavailability. You can kind of see the technique for all of these, how, obviously an intramuscular injection, you're pretty much going to a 90-degree angle. With all these other forms of injection, you're kind of taking a slightly different angle of injection. And then you have your intradermal injection, which is direct injection into the skin. Okay, so again, deepest to most superficial. Again, depending upon the medication that you're looking at will dictate the kind of mechanism for that particular injection. So dosage forms of parenteral drugs. So table 6.3 gives a pretty good outline and explanation of the different types. We already mentioned some of the different types on the previous slide. I would say in addition to that, one of the types that gets talked about in this table is an intraosseous, and that's when a drug gets directly injected into the bone marrow. And again, you can see the absorption patterns of all these and kind of what is the special utility for each one. So there's a reason why some drugs are intravenous, there's a reason why some are intramuscular, there's a reason why some are intraosseous, so on and so forth. So take a look at those. Again, there's going to be different absorption rates for direct administration into body tissue. So in other words, many times if you want a quicker onset for effectiveness, intravenous tends to be very quick. We talk about how, drugs are 100% bioavailable when given via IV. Of course, that also dictates how the dosage gets delivered. Any extravascular, so for instance, a patch has to be absorbed by the bloodstream. So obviously that's going to be a little bit slower rate of absorption. So again, the decision for optimal route when you're looking at these is going to be based upon the therapeutic effect of the individual drug. So, if you want a drug to be, administered faster, so on and so forth, that's going to be the type of thing that you're going to look at in as far as how the drug gets delivered, plus also what particular area or what particular condition has to be affected by the individual drugs. A red flag thing that does come up, and this is talked about in your book. So in the case of an epidural injection, so an epidural is where the medication is getting injected in the space in and around the spinal cord, for instance, there is the potential for a post-dural puncture headache with that. So many times people will get like lumbar epidural steroid injections, very common. If the needle does happen to puncture the dural space, it could leak cerebrospinal fluid, and that could cause a pretty bad headache in patients. So this is definitely something that could happen and is a potential negative effect. They basically just get resolved by administering autologous blood into the epidural space, but that is something that could happen with epidural injections. So when an epidural, so there's a picture kind of showing in your textbook how an epidural is basically gets delivered. They basically go in between the individual vertebrae and inject whatever medication it is. Again, many times, like for instance, people who have pretty considerable back pain from like a nerve root impingement may end up getting a steroid injection into that space. Many times, like another example would be in a female who's getting an epidural analgesia for pregnancy, for giving birth. That may be another situation where that gets administered. But again, this is one of the things that could potentially affect the patient with an epidural injection. So here we are, so looking at the parenteral routes, some other things, just discussing them. So again, IV or intravenous, we've kind of already talked about this already. Again, the systemic circulation is immediate. So depending upon how quickly you want the effects is going to be determined by, is going to help determine how you administer the IV. So for instance, if you want an IV bolus, that's where you want like kind of that immediate reaction from the drug. If you're going to do an IV infusion, that means you want the drug delivered over a prolonged period of time. So that's where they will kind of change the way that an IV is administered. Because if you just gave an IV, in a class, as a bolus, it's always going to have immediate effects, and you don't always necessarily want that. Sometimes that you do want a more sustained effect. Intramuscular. It does get injected into the muscle tissue, which again, sometimes can cause some discomfort. So that's kind of a drawback to the intramuscular injection. So for all of these, you should be thinking, well, what's the positive and what's the negative? Again, a pretty consistent bioavailability. It does still need to reach the circulatory system in order to be effective. Certain drugs aren't good for intramuscular injection simply because of the way the drugs get released, or pain or local irritation from certain drugs could cause that. But again, intramuscular injection can just create some general discomfort because the needle piercing the muscle itself. It could be just it could just be uncomfortable in general. So again, and depending upon, there's certain intramuscular injection sites that's also going to increase how rapidly something is absorbed. So, for instance, a lot of your intramuscular injections go into the deltoid muscle, and that's because there does tend to be pretty good blood flow to the deltoid muscle. So, whereas, some other muscles may not have the same amount of blood flow. So again, you'll see that. So certain drugs will be injected in certain muscles based on how quickly they need to be absorbed. Subcutaneous, that's going to be much slower than intravenous, and it minimizes a lot of the IV risk or the intravenous risks. So, there is some risk with intravenous injection. So, for instance, thrombosis could be something that could happen as a result of IV injection. So, if something, does need to be absorbed slower and you want to avoid that, it could be administered via subcutaneous injection. And again, obviously from mucous membrane drug administration, and again, this will be through the small intestine, buccal, sublingual. We kind of already talked about some of those different types of administration. Again, the mucous membranes are highly vascular, so it does allow the drug to enter the systemic circulation fairly quick. And they're much less of a barrier to drug uptake than even the skin, okay? Again, some mucous membranes, like again, I gave one of the example here, the small intestine, could be a little bit more of a specialized site for absorption, but again, you have other sites that act as this as well. Again, general adverse effects of injections, and this is something that comes up as a red flag within the chapter, just to kind of note. So again, you do risk skin atrophy, tendon rupture, infections. Anytime you're basically going into the body, piercing the skin, there could be obviously a chance of infection. Skin atrophy is something that does happen, and it happens occasionally with like joint injections. So from an orthopedic standpoint, individuals that are getting their joints injected, that's a potential risk with that. There's the potential risk of tendon ruptures. And, one of the ways to kind of mitigate a lot of the potential negative effects of injection is ultrasound-guided injections. So ultrasound-guided injections just kind of enhance the accuracy of the injection site. So if it's an injection site that, there's a, potential for, a lot of structures to be negatively impacted, doing those via ultrasound does tend to be a little bit more precise. Obviously a lot of times, for instance, in physicians' offices, they'll inject, more of your bigger joints, they won't necessarily use ultrasound guided injection because the joint space is really easy to find. Certain things like some injections into the spine, for instance, would be probably an area where it's many times preferred to do like an ultrasound guided or some sort of image guided injection. So topical and transdermal drug administration, so looking at topical drugs. Topical drugs are really good. They basically produce a pharmacodynamic action without affecting other organs. So many of the drugs that we administer topically are designed to treat, for instance, a lot of like superficial skin conditions, infections, things like that. Table 6.4 we'll go through the different types of dosage forms and kind of how they're delivered. So you have, for instance, gels, you have ointments, you have creams, you have lotions, and you have solutions. They all are kind of various ways to administer topical drugs. Again, these drugs are typically intended to have very local effects. And again, you're not going to get kind of like that systemic absorption. So it kind of helps reduce some of like mitigating or basically mitigating or negating a lot of negative effects that you get with things that are kind of dealt with a little bit more systemically throughout the body. Transdermal administration, so this is when drugs are absorbed from the skin and subcutaneous tissue directly into the blood. So, these are administered a little bit more slowly. So the reason why a lot of your transdermal drugs do tend to be really good for people is that they're pretty simple to apply. Again, they're administered very slowly. Now, absorption can be challenging. So again, the makeup of these drugs is really important because the skin is a natural barrier. So the skin is basically to help protect us, and it does provide a barrier to things. So again, that does create a situation where if you are going to do a transdermal drug, it has to be able to penetrate the skin, and then it still has to get into the systemic circulation. So when we're looking at like what's the difference between a topical drug versus a transdermal administration. So a topical is just that. It's kind of just getting administered to the skin to more or less to many times to directly affect things on the skin or in that particular area. Whereas a transdermal administration is looking to typically get picked up by the systemic circulation. Okay, so some examples that are given are the the nicotine and fentanyl patches are examples. Probably the most common thing for ATs to use that would be considered transdermal or lidoderm analgesic patches that are used for pain control purposes. So now we've pretty much looked at all the different types of administration of drugs, and there's various types. Some drugs will be administered in different ways, and some of that we're going to talk about will be dictated based on what we're going to discuss here, the dosing. So again, we're obviously looking for drugs to get dosed within a therapeutic range. So we're looking for that range that's going to produce the best effect while at the same time minimizing problems, because pretty much any drug taken, if you take too much of it, you're going to experience adverse and negative effects. So the way a drug is going to get dosed is going to depend upon a couple different things. So first of all, obviously the drug delivery system used. So, how the drug delivery system is happening is going to dictate it. You also have the route of administration and the frequency of dosing, which we'll kind of talk about. The frequency of dosing is going to be kind of based upon the therapeutic window for a drug, and there's some terms and things that we'll discuss on this particular section here that will explain that. And obviously the drug clearance rate, so how quickly does the drug get cleared from the body, because you don't want to basically build up concentrations of the drugs to where there would be the potential for toxicity. So the goal is to sustain plasma concentrations in a therapeutic window. Okay, again, without creating toxic or negative effects. So some things you have to consider. So for certain drugs, you may need to do what's called a loading dose. Okay, so a loading dose is an initial dose to get the plasma to the target concentration. So if it's so for instance, a drug that maybe say has a long half-life, you may need to do a loading dose. And what that does is it's basically a larger initial dose to kind of help get to that plasma target concentration, and then after that you may reduce the amount of drug you're given then in ongoing doses. So that's if you hear something needing a loading dose or having basically having a loading dose, that's what you would be doing with that particular type of drug. Then you have a maintenance dose. So once a steady state concentration is in the plasma, whether that occurs as a result of a loading dose or whatever the protocol would be, that's where then you're going to do a maintenance dose. And that's just to keep it at a steady state concentration in the plasma. So basically a steady state, the dosing coming in is equal to the rate of elimination or the rate of the drug basically getting eliminated from the body. The duration of action, that's just the time required to produce the desired effect. So basically it's the time for a single dose of medication to produce whatever effect that is looking to come about through the drug. Your dosing frequency, obviously the greater the frequency, you're going to have a smaller dose. So if for some reason a drug has to be administered more frequently, the dose of the particular drug is going to be smaller. The dosing interval, the longer the inner dose time goes, the greater amount to maintain concentration. Okay, so these are just some terminology related to the particular drugs and their therapeutic window. There's just a figure from the book just kind of showing plasma levels basically after an oral administration of a drug that has an immediate release dosage form. So the thing just to note here is, again, your therapeutic range, we've kind of defined what that is. That's the concentration interval between the minimal effective concentration and the minimal toxic concentration. And again, things like this will kind of determine, so, looking at this is an immediate release dosage form, and that's basically going to impact the specific time interval in which the particular drug is given. So clinical procedures for enteral drug administration. So again, most enteral drugs are going to be oral drugs. Again, as we all know, again, we've probably, just every single person at this point probably has taken some type of oral medication. Again, we have our different types. So again, just make sure that you're aware of like what constitutes something being a capsule versus a caplet. Here I'm even talking about enteric coated tablets, understand what that is, and your different types of liquid oral medications. So just some cautions with these. Obviously, we know one of the big things is typically gastrointestinal dysfunction is probably one of the more common things that you deal with a lot of oral drugs that are, particularly have to go through that are going to be going through the gastrointestinal tract. Also, it could also be a complication if an individual cannot swallow pills. That could be an issue as well. So that may be, so here's a situation if you're saying, well, if a medication is available via pill form versus a liquid form, why would you pick one over the other? Well, if somebody can't swallow a pill, then they have to take it in liquid form. So probably a very simple way to look at that would be is if you look at most very young children, most of them can't swallow pills yet. So, if a child has, say, an ear infection and they're going to get prescribed an antibiotic, they're going to get it prescribed in liquid form simply because they probably can't swallow pills, whereas an adult would probably get it in pill form because they could swallow. Because it's also important that you can't chew certain medications. So most pills that are available for obviously just having to swallow them, you can't chew them, okay? Yes, some tablets and things like that can sometimes be crushed up and put in food. You'll hear about, some individuals may crush up medications and maybe mix it with it's very, very common to see some medications get mixed with things like applesauce and things like that. That's not uncommon. And that's okay as long as you could do that with a particular type of medication, but not all medications. Some medications, in whatever solid form they're in, that's how they have to be consumed. So make sure that certain medications are not chewed or crushed up. And the medication, the information will many times, even in basic medication information packets, I'll tell you that. So so what you should know medications, purposes, adverse effects, patient preferences, patient allergies. So, and again, as we'll talk about and go through, again, you're not expected to know every single type of drug, but the concepts that we discuss should help you understand, and you should be aware of those. And again, you'll use resources where needed. And again, always, consult with the pharmacist or provider if you have any concerns. So if whatever the patient say, you may have a patient come to you and say, hey, I started taking this medication for this, and this is what I'm experiencing, or they may, so they may report to you a negative effect or a negative side effect. It's really important then for you may have to kind of be that, sort of bridge between them and the provider to find out, is there another option? Or you may even know of another option. Obviously, you're not necessarily going to be able to, if it's a prescription, you're not going to be able to directly do anything about that right away, but at the very least, maybe you can make a suggestion to the physician or other provider. So again, in summary, be familiar with drug delivery, dosing, and administration. So again, make sure you review all the advantages and disadvantages of all those common routes. Again, I think those tables in your book can be very beneficial. We've kind of talked about some specifics. Again, kind of make sure you're aware of that. Understand the limits of enteral and parenteral medications. Again, anytime a parenteral or for some parenteral forms of administration, aseptic techniques have to be maintained. So that obviously we're referring to our injections with that because of the fact that there's always a risk for infection. So we have to make sure that if Individuals are going to get injections. Everything should be very, clean and sterile. And again, pain, anxiety associated with injections is possible. Some people just don't like getting injections. So very important that, those factors are taken into consideration. So if maybe something, could be maybe administered another way, then those would be options. In emergency situations, realize that a route other than oral may be preferred. So that's where we talked about, some of these different routes. Even with enteral drugs, you have, for instance, rectal suppositories. In the case that somebody may not be able to swallow a tablet, capsule, or any other form of pill, those other routes do exist. So in those situations, that's where the other routes. So if you're saying to yourself, I don't understand why you would administer a drug this way if there's an oral route, that could be the reason why, or there could be other circumstances where an individual may not be able to take a drug by mouth. So these are your objectives to review for the exam.